Hello students, last class we have discussed about the seizure and the epilepsy introductions, and we have mainly discussed about the seizure types and its the pathophysiology or the pattern of the seizure. In today's classes we are going to discuss about the epilepsy. Okay, so we know that epilepsy is a repetitions of the seizure. So if you want to take a classical definitions of the epilepsy, it goes like this. It is the recurrent spontaneous tendency of the seizure which is clinically manifest. It is known as epilepsy. Okay. In seizure, we have studied that it is the abnormal neural discharge or abnormal neural electrical activity that happened into the CNS or central nervous system that resulting in abnormal motor movements, abnormal sensory experiences and abnormal psychomotor experiences, right? As we have studied, brain is not only controlling our motor movements, it is also controlling our sensory movements, it is also controlling our psychomotor experiences. So when any part of the brain which get involved due to the electrical abnormality, so that particular part will have a misfunction. So when that particular area or the particular brain cortex will have a misfunction, it can lead to not only motor movement problem, it can also lead into the abnormal sensory experiences and abnormal psychomotor experiences too. Okay, that is why first class itself I have told you, never ever we should do the underdiagnosed and the overdiagnosed of the epilepsy or the seizure. Okay, now we will discuss about the epilepsy and its types. Okay, so basically there are three types of epilepsy based upon the area of the brain has involved. Okay, if any one, see this picture, okay, the left sided picture I'm talking about. If any one particular hemisphere of the brain, we have two hemisphere, right? We have right sided hemisphere is a left sided hemisphere. So if any one of the hemisphere is involved with the neural discharge or the abnormal neural electrical impulse activity, that resulting in patients like abnormal motor, abnormal sensory or abnormal psychomotor experiences, any one or either it can be including three also. So if any particular one sided of the brain or one hemisphere of the brain is affected, it is known as partial or focal epilepsy. Okay, and if both of the hemisphere of the brain, it means the entire brain is involved due to some problem, I will come to that part, some problem, that is the causative factor I will discuss in details. If due to any causative factors, if the entire brain hemisphere cortex is involved, so what is happening here? Here almost all over the brain, electrical impulse or the electrical activity is getting disrupted. So the symptoms also will be very severe. So that is called generalized epilepsy. Okay, and another one is there, that is the secondary type that I will discuss. Okay, so in partial epilepsy, what is happening? Because our brain, any one hemisphere, either right or either left, is getting affected. And what is the reason of this partial epilepsy? There is a usually GABA, the full form of GABA, you know, right? Gamma amino butyric acid. It helps relaxations to the brain in certain cases, or if the brain is getting too much function, right, we need some rest. So GABA is helping to relax the brain. But sometimes in some cases, if the GABA level is increasing, that will inhibit or stop the electrical impulse circulations to the brain. So what happens when we do any work, our brain neurons will function a lot. Okay, let's make you understand a very simple way. Look at this picture very carefully. Okay, the second one, reticular activating system. How it's work? When you are sleeping, when you are waking up at the morning, you will the light will come to your eyes, that sensation will pass through the thalamic cortex, it will pass to all over the brain, right? And you will wake up. But GABA, what if the level is getting too high or too increase? That will block the impulse, so the brain neuron will not get the impulse properly, and that will be leading to the some sensations or the some epileptic conditions for the patient. So there is a very deep relations with the GABA and the epilepsy. So what happened, sometimes it may affect your thalamic cortex and the diencephalon, sometimes it may not involve your thalamic cortex or diencephalon. Okay, so in partial epilepsy, I'm talking about in partial epilepsy also, there are two types, that is simple partial, another one is complex partial. What is simple partial epilepsy? Where there is no involve of the thalamic cortex and the diencephalon. Sorry, just a simple mistake. There is an involve of the thalamic cortex, of course, but there is no diencephalon involvement, because we know if the diencephalon is one of the vital part which is helping for our consciousness, right? So diencephalon will not be affected in these cases, but only thalamic cortex will get affected. So in that, the persons will not have any changes in the consciousness, but the person's body movement will not be normal. That is called simple partial epilepsy. And complex partial epilepsy, this is also partial. Okay, this is also partial, but here thalamic cortex and the diencephalon, they both got involved. So when they both got involved, of course diencephalon is getting affected. It means the consciousness will not be normal, there will be a altered consciousness level, and that is called complex partial epilepsy. Okay, so whenever you are writing the epilepsy types, partial epilepsy, here you have to mention that there is a GABA receptors elevation, and that elevations of the GABA will inhibit the electrical activity of the brain. Therefore, sometimes diencephalon also involved. Thalamic cortex, definitely it will get affected, but also it can affect the diencephalon. So when there is an involvement of the diencephalon, the patients will be having loss of consciousness, but one hemisphere is getting affected, and that is called complex partial epilepsy. And when there is a no diencephalon involvement, there will be a no altered consciousness, but the patients will have some unusual body movement, and that is called simple partial epilepsy. Okay, so I hopefully have cleared the doubt. Now let's move to the third type, which is a very, very important type, that is a pseudo seizure and status epilepticus. Both are different. Okay, pseudo seizure is any psychiatric conditions related. Okay, example, the patient is he had some issue, or he had some conditions of schizophrenia or paranoid or anything, that the patients may show that they will be shivering a lot. Sometimes you may have observed that the patients who is too much in shock because of any one family member loss, they will be crying. At some point they will lose the consciousness. Sometimes they faint, sometimes they will be shaking, and sometimes they may claim that they are having some demonic activity. Those are actually pseudo seizure. Okay, those are not exactly seizure. So their diagnostic evolutions and the treatment also different. Okay, but status epilepticus is one of the most medical emergency of the epilepsy. Here what happened, the patient will not be conscious, and the seizure will be more than 5 minutes. Okay, and this is the true seizure. When the seizure will be lasting more than 5 minutes, there is a chances that all the muscle, including your thoracic okay, including, like, it means the respiratory muscle also sometimes get involved. And what happen in these cases is, it means the status epilepticus cases, the patients, when they will have a more than 5 minutes of seizure, they sometimes they may swallow their saliva also, and it will not go to the esophagus, it will directly move towards the airway. So the patients will have a severe choking and sometimes may die also. That is why status epilepticus need a very emergency treatment. Okay, that is why knowledge should be proper. Don't minimize your knowledge anytime, dear. Okay, so what can be the causes? It means the epilepsy, this is partial epilepsy or focal epilepsy. It has two types, simple partial and complex partial. Generalist means both the hemisphere are involved here, right? And also status epilepticus and the pseudo seizures we have discussed. So what is the causes or the etiology? There is a short form that you can remember, that is vitamins. See, I have mentioned over there. V for any vascular conditions like stroke, okay, infections like meningitis, encephalitis. T for anything trauma or toxicity of the drugs. A for any autoimmune disease, okay. M for any metabolic conditions like, if anything, hypoglycemia, hypernatremia or hypokalemia, where there is a electrolyte imbalance that will lead to the neural function disturbance, and through that the person may get the seizure, or the follow up that they may get the epilepsy. And some idiopathic reason also is there. And N for neoplasm or any tumor formations. Of course, if any tumor is forming inside the brain, that may lead to the some, definitely they will release some chemicals, right? And that will lead to the, of course, neural burst, and finally it will be representing as a seizure. And any psychiatric conditions, S for. So this is a very easy name that you can remember, that is vitamins. Okay, you can take a snap of this. Okay, now come to the pathophysiology. This is the standard one pathophysiology, okay, that you need to mention, because seizure will not be occurring in one way. You have to mention those way also. Now look at the pathophysiology very carefully. First, due to etiological factors that we have studied, vitamins, right? Let's take one more look. Vitamins. So due to this many causes, what all the way brain can damage? The brain will be getting damaged, definitely. And when the brain will get damaged, and there is a alternations in the neural circuitry system, sometimes they will be leading to the neurotransmitter imbalance. See, glutamate, GABA, serotonin, dopamine, noradrenaline, right? Everything, they will be changing themselves. Then if any tumor or something happened, that may involve into the inflammatory cytokines will be releasing, right? And some, due to these causes, there can be a altered neurogenesis and gliosis. And also due to these causative factors, when the brain will get damaged, it may lead to the some imbalance in the ions. So in a very simple way, this is the imbalance of the micro and the macro elements. Okay, so due to this many changes, what will happen? The neuroburst will occur, right? The neuroburst will occur. So when there is a neuroburst or the abnormal neural changes will occur, what will happen? There will be a recurrent seizure if it is not treated. And recurrent seizure, when it will occur, either it will be changing the patient's involuntary contractions of the muscle, then loss of consciousness, and it can also lead to post-ictal confusion, right? When the patients will have altered seizure sensations. And sometimes if it is got to status epilepticus, there will be a losses of airway reflex, aspirations of the saliva and the food contents, aspirations pneumonia, and also there will be a sudden unexplained death of epilepsy patients. That is called Sudeep. Sudeep is the Indian name that we can remember, right? Sudeep will occur. That is called sudden unexplained death of epilepsy patients. So let's take a one more time. Due to these etiological factors, there will be a changes in the brain neural activities, right, or the brain cortex, and those changes will lead to either neurochemical disturbance, either inflammatory cytokines will release, either neurogliosis will occur, or either imbalance of the electrolytes will occur, and those alternations altogether will cause the abnormal changes of the brain neural impulses or neural bursting that will lead to the recurrent seizure, and finally when that recurrent seizure will occur, that will lead to the sudden unexplained death, or sometimes if the patient is getting relieved, they may have post-ictal confusion, sometimes they will have a loss of consciousness, and sometimes they will have a involuntary contractions of the muscle. Okay, and if sometimes seizure occur, the patients will lose the consciousness, so they will swallow the food and the saliva that will go to the lungs, and it can also lead to the aspirations pneumonia. Okay, so this many causes can occur, or this is the pathophysiology of the epilepsy or the seizure. So this is the exact one that you should mention. Okay, what is the diagnostic evaluations of the seizure? So based upon vitamins, right? See, I mentioned here vitamins. So if the causes is from vascular, we have to go for CT, MRI, blood test and lumbar puncture. But lumbar puncture, when we will not do if the patient ICP is very high, we should not do. Okay, but we can do if it is required. Okay, if it is from infection related epilepsy or the seizure, we can go for blood culture, we can go for CT, we can go for MRI, we can go for CBC. If it is trauma related, best choice is go for CT and the MRI. If it is any autoimmune disorders, we can go for any specific antibody test, we can go for CT, CAP, right? If it is from metabolic conditions, we can go for immediately blood test, right, to check the glucose level. If the causes is hypoglycemia, of course we will do the immediately glucometer test, right? We can go for BMP, we can go for liver function test, we can go for TFT, thyroid function test, right? Or increased ammonia level also, sometimes the patients will have a epilepsy or seizure. We can go for NH3 state test also, right? And also we can go for neoplasm, it means the tumor cases. We can go for PET scan, MRI with contrast, and S for psychiatric assessment, right? As psychiatric conditions also can causes the pseudo seizure, we can go for a psychiatric assessment. So let's repeat once what we have studied. We have studied about the epilepsy, the two types, focal or the partial, and the generalized epilepsy. We have studied about the pseudo seizure and status epilepticus. We have studied the causes or the etiology. The short form is vitamins. We have studied the pathophysiology. We have studied the diagnostic evaluations of the seizure. Next classes, we will study the treatment of the epilepsy in detailsly. Okay. Thank you all.